In this session, we will discuss about femoral triangle. Before going to discuss about femoral triangle, let me introduce few muscles which are present in the anterior aspect of the thigh. See here, this is the symphysis pubis and this is pubic tubercle. And what is this? Obturator foramen. And this is the ischiopubic ramus. And this is anterior superior iliac spine and this is anterior inferior iliac spine. This is the head of the femur and this is the neck of the femur. This is greater trochanter, this is lesser trochanter, and in the posterior aspect I am drawing dotted lines. Here you can found the linea aspera. That means the posterior border of the femur, what we call linea aspera. See here I have drawn few vertebrae T12, L1, L2, L3, L4, L5, and this is the sacrum and this is coccyx. See, this is the ilium and here one fossa is there. This fossa what we call iliac fossa. And here this projection is there, that is what we call ischial spine. And in the central part, this is the symphysis pubis. Now let me tell you few muscles, origin and insertion. They are only forming the floor of femoral triangle. This is the angle between the superior border of the body of the pubis and this is the medial border, otherwise symphysial surface of the pubis. Here this is the origin point of adductor longus muscle. This is the adductor longus muscle. This is the origin. From here, muscle will go obliquely and it will be inserting to the linea aspera. See here, in the posterior aspect. So, this is the adductor longus muscle. Next to this, here, this is the pectineal surface of the pubis. This part what we call pectineal surface of the pubis. From the pectineal surface of the pubis, one muscle will be arising, right? So that muscle I will draw from the pectineal surface. Pectineus muscle is arising. So this is the pectineus muscle. Then these are the lumbar vertebrae. From the anterior aspect of transverse process of all lumbar vertebrae and bodies of 12 thoracic vertebrae and all lumbar vertebrae. From there, one muscle is taking origin. What is that muscle? Psoas major muscle. So, here from the bodies of 12 thoracic, first lumbar, second lumbar, third lumbar, fourth lumbar and fifth lumbar. Along with that, anterior surface of transverse process of L1, L2, L3, L4, L5. So, bodies of T12 to L5 and transverse process of L1 to L5. I am not going in detail, you remember this much, that is sufficient. So, transverse process of L1 to L5 and bodies of T12 to L5. From there, muscle is taking origin. What is that muscle? Psoas major muscle. So, this is adductor longus muscle, this is pectineus muscle, and which I am drawing, this is psoas major muscle. So, origin is here. Where it is inserting? By the fusion of tendon of iliacus. Both tendons will be united and forms the iliopsoas. That will be inserting to the lesser trochanter. So, this is the psoas major muscle. What is the peculiarity of psoas major muscle? Within the psoas major muscle, lumbar plexus will be present. Important MCQ. Now we will see one more muscle which is taking origin from this fossa. What is this fossa? Iliac fossa. Actually, inner margin of the iliac crest and also from the iliac fossa, one muscle is taking origin. That muscle what we are calling iliacus muscle. So, here I am drawing a iliacus muscle. This iliacus muscle, fibers of this iliacus muscle runs downwards and becomes a tendon, and that also will be inserting to the lesser trochanter. I hope you can differentiate the iliacus muscle and the psoas major. See, this is psoas major and here is the iliacus. Let me label it. This muscle is adductor longus. What is this muscle? Adductor longus. And what is this muscle? Pectineus. And what is this muscle? Psoas major. And what is this muscle? Iliacus. Now we will draw one more muscle which is taking origin from the anterior superior iliac spine. See, this is the anterior superior iliac spine. That means anterior most part of the iliac crest, what we call anterior superior iliac spine. From this anterior spherical spine, there will be origin of one muscle. What is that muscle? Taylor's muscle, sartorius. See, it is taking origin from here and it runs downwards and passes little posterior to the medial condyle of femur, and it will be inserting to the medial surface of upper part of the tibia along with gracilis and semitendinosus, right? That we'll discuss little later. So this is the muscle. Now we have to draw one ligament, the ligament which is extending from the anterior superior iliac spine to the pubic tubercle. What is this ligament? Inguinal ligament. What is it? Inguinal ligament. Let me draw that inguinal ligament. So this is the attachment. See here, in the upper part of the thigh, just below the inguinal ligament, here you can see one triangle. Is it? This triangle, what we are calling femoral triangle, right? Now we'll see the boundaries of it. See, laterally, what is there? See, this is the sartorius muscle, right? Medial border of sartorius. Lateral boundary is formed by the medial border of sartorius. And what is this muscle? Adductor longus. So, medial boundary or medial border is formed by medial border of adductor longus. See here, sartorius also medial border and the adductor longus also medial border only, right? Then base is formed by inguinal ligament. Then apex, here is apex where the lateral border and the medial border is meeting. This part what we call apex, right? So adductor longus and the sartorius, here they are meeting, no? This point what we call apex. So femoral triangle is nothing but it is triangular depression present in the upper 1/3 of the thigh below the inguinal ligament. This triangular shaped depression what we are calling femoral triangle. It is having base, apex, medial boundary, lateral boundary, roof and floor. Base is formed by inguinal ligament. Medial boundary is formed by the medial border of the adductor longus. Lateral boundary is formed by the medial border of the sartorius. Apex is formed by the union of lateral and medial boundaries, that is here. That means at the meeting point of inferior margin of the adductor longus and the sartorius. So this point what we call apex. Then what are the muscles which forms the floor? See, is it triangular in shape? If this is the triangle, these are the muscles which are forming the floor, right? What are the floor muscles? See here, this muscle is adductor longus. This is adductor longus. Then what is this muscle? Pectineus. And what is this muscle? This muscle is psoas. That means psoas major muscle. Then what is this muscle? Iliacus. So these muscles will form a floor. How can you remember? Remember A, P, P, I. A P from medial to lateral side, adductor longus, pectineus, psoas major, iliacus. So floor muscles from medial to lateral side, a P, adductor longus, pectineus, psoas major, iliacus. So these are the floor muscles. Now we will see the roof. If you wanted to see all these structures, you have to remove the skin, right? So skin, after skin, superficial fascia and its contents. Then deep fascia, that is nothing but fascia lata. After fascia lata, you can see the triangular depression. That means roof is formed by skin, superficial fascia and fascia lata, that is nothing but deep fascia of the thigh. These are the different boundaries. But in the superficial fascia, some other structures also present. What are those? Superficial fascia contains superficial group of inguinal lymph nodes, superficial branches of femoral artery and corresponding means and terminal part of great saphenous vein. Along with that, you have to remember femoral branch of genitofemoral nerve. So these are the structures which are present in the superficial fascia. If you can't remember all those things, at least you remember roof is formed by skin, superficial fascia, deep fascia. The deep fascia is nothing but fascia lata. That's it. So now we have studied about the femoral triangle boundaries. Then what are remaining? Contents. So what are those contents? Over the psoas major, femoral artery. Actually, femoral artery is continuation of external iliac artery. Of course, if you see, this is the aorta. Aorta will be divided into two common iliac arteries. This is internal iliac artery and here is the external iliac artery. This external iliac artery continues down as femoral artery. So this is internal iliac artery. This is external iliac artery. External iliac artery continues down over the tendon of psoas major. Actually, it is present in the mid-inguinal point. What is mid-inguinal point? If you take the point in between the anterior superior iliac spine and symphysis pubis, exactly at the midpoint, you can find the artery and you can feel the pulsations also. And if you wanted to compress the artery to prevent the bleeding from the lower part of the limb, we have to compress the artery just below the inguinal ligament against the superior ramus of the pubis or the head of the femur. So this is the femoral artery. Next to the femoral artery, what will be there? Medial to the femoral artery, there will be vein. What is that vein? Femoral vein. Here is the femoral vein. So this is femoral artery and this is femoral vein. Then what are the other structures which are present in this triangle? You can see one nerve which is descending down in the lateral most part. That is what we call lateral cutaneous nerve of thigh. That lateral cutaneous nerve of thigh is passing beneath the inguinal ligament and it runs downwards and it will be supplying to the anterolateral aspect of the thigh and also lateral aspect of the gluteal region. So what is this? This is the lateral cutaneous nerve of thigh. Then one more important structure is there. What is that? Here is the femoral nerve. Femoral nerve is present in between the tendon of iliacus muscle and psoas major. Actually, it is branched from the lumbar plexus. That means it is arising from anterior primary rami of L2, L3, L4. These L2, L3, L4 will be divided into ventral divisions and dorsal divisions. So, dorsal divisions of anterior primary rami of L2, L3, L4 will forms the femoral nerve. That will be emerging out from the lateral border of psoas major muscle and it will be descending down deep to the fascia iliaca, otherwise the fascia which is covering the iliacus muscle, and in between the iliacus muscle and psoas major, it appears in the femoral triangle. That means it is passing deep to the inguinal ligament and it appears in the femoral triangle. As soon as entering into the femoral triangle, around 2.5 centimeters below the inguinal ligament, it will be divided into two divisions. Those are anterior division and posterior division. We will discuss about femoral nerve in the next session. So now we have drawn femoral artery, femoral nerve and femoral vein. Then any other contents are present here. This is the inguinal ligament. No, this inguinal ligament, after attaching to the pubic tubercle, it will be reflected back as pectinate ligament. This pectinate ligament will be attaching to the pectine pubis. In between the inguinal ligament proper and the pectine pubis, here you can see one triangular ligament. This triangular ligament, what we call lacunar ligament. What is called? Lacunar ligament. Remember this. So here lacunar ligament is there. And what is this ligament? Pectineal ligament. And what is this ligament? Inguinal ligament. Let me tell you the contents which are discussed till now. Femoral vein, femoral artery, femoral nerve. There will be one more nerve which is supplying to the skin over the femoral triangle. So what is that? Femoral branch of genitofemoral nerve. What is this? Femoral branch of genitofemoral nerve. Then any other structures are present? Yes. Here you can find some lymph nodes. Those lymph nodes what we call deep group of lymph nodes. These are what we call deep group of lymph nodes. Then see here, external iliac artery and the external iliac vein. In the abdomen, they are covered by anteriorly fascia transversalis, posteriorly by fascia iliaca. Right? So that fascia will be extending down into the thigh also. Right? So that fascia which is covering the femoral artery and femoral vein, what we call femoral sheath. So this artery and vein covered by a sheath called femoral sheath. Now we have drawn almost all structures which are in relation with the femoral triangle. Now we can easily discuss what are the different boundaries and contents of femoral triangle. It is triangular shaped depression present in the upper one third of anterior aspect of the thigh below the inguinal ligament. Boundaries are laterally by medial margin of sartorius muscle, medially by medial margin of adductor longus, base is formed by inguinal ligament, and apex is formed where the medial boundary and lateral boundary is meeting. This point what we call apex. Then floor, from medial to lateral side there are four muscles: adductor longus, pectineus, psoas major, iliacus. You can remember API. Adductor longus, pectineus, psoas major, iliacus. Then roof. Roof is formed by skin, superficial fascia. Within the superficial fascia some structures are present. Those are superficial inguinal group of lymph nodes, superficial branches of femoral artery and corresponding veins, femoral branch of genitofemoral nerve, and terminal part of great saphenous vein. Here you can see the great saphenous vein. So these are the structures which are present in the superficial fascia. After that, deep fascia. These are the different boundaries. Very simple. Don't confuse in the roof. If you wanted to see the femoral triangle, first you have to remove the skin. Then superficial fascia. In the superficial fascia, you have to observe some structures. What are those? Terminal part of great saphenous vein, superficial inguinal group of lymph nodes, then superficial branches of femoral artery and corresponding veins, femoral branch of genitofemoral nerve. So these are the structures which are present in the superficial fascia. Then fascia lata. Clear? So these are the boundaries. Then what are the contents? See, first we will take the structures which starts with femoral because it is femoral triangle. So we will take the structures which starts with femoral. What are those? Femoral nerve and its branches, femoral artery and its branches, femoral vein and its tributaries, femoral sheath and femoral branch of genitofemoral nerve. So these are the structures which starts with femoral. So you can easily remember. Then what are the other structures? See here, lymph nodes are there. These are deep inguinal group of lymph nodes. Then lateral cutaneous nerve of thigh. After that, nerve to the pectineus. Actually, nerve to the pectineus will be given by the femoral nerve above the inguinal ligament only. So it is branched from the femoral nerve above the inguinal ligament. Then it runs behind the femoral sheath and reaching the anterior aspect of the pectineus where it supplies to the pectineus muscle. So this is also one of the content of femoral triangle. Right? So these are the different contents which are present in the femoral triangle. This is only about the femoral triangle. Let me tell you femoral triangle in very brief manner. Femoral triangle is triangular shaped depression present in the upper one third of anterior aspect of the thigh below the inguinal ligament. It is bounded laterally by medial border of sartorius, medially by medial border of adductor longus, and base is formed by inguinal ligament, apex is formed where lateral boundary and medial boundary is meeting, and floor is formed by adductor longus, pectineus, psoas major, iliacus. Roof is formed by skin, superficial fascia and fascia lata. In the superficial fascia some structures are present: superficial inguinal group of lymph nodes, superficial branches of femoral artery and corresponding veins, then femoral branch of genitofemoral nerve and the terminal part of great saphenous vein. So these are the boundaries. Then contents: femoral nerve and its branches, femoral artery and its branches, femoral vein and its tributaries, femoral sheath, femoral branch of genitofemoral nerve. After that, lateral cutaneous nerve of thigh, deep inguinal group of lymph nodes, nerve to the pectineus. These are the different boundaries and contents of femoral triangle. Then we have to discuss about femoral sheath separately because it is also important 5 marks question. Now we are taking this femoral sheath here and we will discuss. Femoral sheath is nothing but it is funnel shaped sheath or funnel shaped fascial sheath which is covering the upper part of the femoral vessels. Otherwise upper 3 to 4 centimeters of the femoral vessels. So that is what we call femoral sheath. Femoral sheath is formed by anteriorly one layer and posteriorly one layer. Anterior layer is formed by fascia transversalis. Posterior layer is formed by fascia iliaca. Lateral margin of this sheath is vertical and the medial margin is oblique. what are the contents which are present here? Femoral artery, femoral vein and deep inguinal lymph nodes. But the femoral nerve is not present within the femoral sheath because this nerve is present posterior or it is present deep to the fascia iliaca. So femoral nerve is not a content of femoral sheath. This is a brief idea about the femoral sheath. Now we will discuss in detail. For that, I am taking the rough diagram of this area. This is the anterior superior iliac spine. And here symphysis pubis and here pubic tubercle. There will be one ligament which is stretching from anterior superior iliac spine to the pubic tubercle. This ligament, what we call inguinal ligament. Inguinal ligament, after attaching to the pubic tubercle, it will be extended laterally and attaching to the pecten pubis. After attaching here, some fibers, they attaches to the pecten pubis. This ligament, what we call pectinate ligament. In between the inguinal ligament proper and pectinate ligament, there will be one more ligament. This ligament, what we call lacunar ligament. So, this is lacunar ligament, this is pectineal ligament and this is the inguinal ligament. Now, femoral artery is continuation of what? External iliac artery. So, here external iliac artery and continues as what? Femoral artery. Next, what is there? Femoral vein. Actually, femoral vein continues up as external iliac vein. So, here is the external iliac vein. Femoral vein only continues as external iliac vein. So, this is the femoral vein. Femoral vein is present medial to the femoral artery at the base of the femoral triangle. But when it reaches to the apex, femoral vein is present posterior-medial to the femoral artery. So, these are the femoral vessels in the femoral triangle. These vessels are covered by anteriorly one sheath and posteriorly one sheath. Totally it forms a femoral sheath. So what are those? Anterior layer of femoral sheath is formed by fascia transversalis. Posterior layer is formed by fascia iliaca. This is the anterior layer and this is the posterior layer. So if you come into the description of femoral sheath, it is funnel shaped sheath which is covering the upper 3 to 4 centimeters of the femoral vessels, and it is formed by anteriorly by fascia transversalis, posteriorly by fascia iliaca. Lateral margin is vertical and medial margin is oblique. This sheath will be divided into 3 compartments by 2 septa. There will be 2 septa which is extending from anterior to posterior side. Here one septa, this septa what we call lateral septum, and here medial septum. So that this sheath will be divided into 3 compartments. This is the lateral compartment, this is the middle compartment and this is the medial compartment. I will take this diagram as simple diagram here. This is the posterior wall formed by fascia iliaca. This is anterior wall formed by fascia transversalis, and it has been divided into 3 compartments by 2 septa. This is lateral compartment contains what? Femoral artery. Along with that, there will be one nerve. This nerve what we call femoral branch of genitofemoral nerve. It pierces the anterior layer of the femoral sheath and it supplies to the skin over the femoral triangle. So this is the nerve, femoral branch of genitofemoral nerve. Then femoral vein. This is femoral vein. Then medial most compartment contains a lymph node called lymph node of Rosenmuller or lymph node of Claquette. Lymph node of Claquette or lymph node of Rosenmuller. So this lymph node is present in the medial most compartment. Now we know what is femoral sheath, how it has formed and how it has been divided into 3 compartments. Now we will see what is the function and what are the structures which pierces the femoral sheath. What is the function of femoral sheath? This is the sheath which is covering the upper part of the femoral vessels. It allows the femoral vessels to move up and down behind the inguinal ligament when we are doing flexion and extension of the thigh. That means during the hip movement, femoral vessels will go in and out. In this process, if there is no any sheath surrounding the femoral vessels and if the only inguinal ligament is there, it leads to injury to these vessels. So that's what there is a sleeve. This sleeve or the sheath will be allowing the gliding of these vessels. So what is the function of it? It allows the free gliding of the femoral vessels in and out behind the inguinal ligament during hip movement. So this is the function of femoral sheath. Next, what are the structures which pierces the femoral sheath? See here, I have already told you This is the femoral branch of genitofemoral nerve. It pierces the anterior layer of the femoral sheath and it supplies to the skin over the femoral triangle. So this is the one structure which is piercing the femoral sheath. Then this is what great saphenous vein. This great saphenous vein will be piercing the anterior layer and it will be opening into the femoral vein. Then any other structures? See here. This is the femoral artery. Femoral artery will be giving some branches. What are those? Superficial, external, pudendal. It pierces the femoral sheath and it comes out. So what is this? Superficial, external, pudendal. Here one branch is going up, that is superficial epigastric artery. Then superficial circumflex iliac. So superficial circumflex iliac artery, superficial epigastric artery and superficial external pudendal artery. These arteries also will pierces the femoral sheath and comes out. These are the structures which pierces the femoral sheath. Now we have to discuss about the medial most compartment of the femoral sheath. This medial most compartment of the femoral sheath, what we call femoral canal. This compartment what we call femoral canal. This femoral canal also funnel shaped. Funnel shaped means what? It is having the base in the upper part and in the lower part it is narrow. Actually it is around 1.5 centimeters length and width is 1.5 centimeters only at the base. At the base only it is 1.5 centimeters. This base of the medial most compartment or this base of the femoral canal, what we call femoral ring. This femoral ring having some boundaries. It is having anterior boundary, it is having posterior boundary, it is having medial boundary and it is having the lateral boundary. This is the anterior boundary. Anterior boundary is formed by, what is this ligament? Here, inguinal ligament. Posterior boundary is formed by fascia which is covering the pectineus muscle. Here there will be pectineus muscle. So that pectineus muscle will be covered by fascia. That fascia what we call pectineal fascia. Then medial boundary is formed by, what is this? Lacunar ligament. So medially lacunar ligament. Then lateral boundary is formed by the septum which is separating the venous compartment from the lymph node compartment. Actually this lateral compartment what we call arterial compartment, middle compartment what we call venous compartment and the medial most compartment what we call lymph node compartment. Let me tell you the boundaries of femoral ring. Anteriorly by inguinal ligament, posteriorly by fascia which is covering the pectineus muscle, medially by lacunar ligament, laterally by septa which is separating the venous compartment from the lymph node compartment. So this femoral ring covered by some extraperitoneal connective tissue. This extraperitoneal connective tissue covering over the femoral ring, what we call femoral septum. The extraperitoneal connective tissue which is covering the femoral ring, what we call femoral septum. That femoral septum will be covered by parietal peritoneum and forms a depression. That depression what we call femoral fossa. So we have to remember few structures. It starts with femoral. This canal what we call femoral canal. The base of the canal what we call femoral ring. And extraperitoneal connective tissue which is covering the femoral ring what we call femoral septum. Parietal peritoneum is covering the femoral septum and forms a depression. That depression what we call femoral fossa. This is about the femoral canal. Within the femoral canal what is present? See this lymph node. What is lymph node? Lymph node of Claquette or lymph node of Rosenmuller. It drains the lymph from the glans penis in case of males, glans clitoris in case of females and also from the superficial inguinal group of lymph nodes. So this is about the femoral canal. Through this femoral canal, some abnormal protrusion or the herniations will happen. Here abdominal contents are there. That means coils of intestine. Coils of intestine along with omentum, along with blood vessels. Those will be protruded through this gap and they pass through this canal and here there is a one more opening is here in the deep fascia. This opening what we call saphenous opening. So abnormal protrusion of abdominal contents through the femoral ring. Contents will descend down first. After that they reaches to the saphenous opening. Then from the saphenous opening they comes forwards. After that they ascends up through the superficial epigastric vessels. The course of the hernia will be directed downwards, then forwards, then upwards. That means it's like a U shape. If you wanted to reduce that hernia, you have to ask the patient to flex the thigh. Then you have to follow the reverse course. That means what? First you have to push the hernia down, then backwards, then upwards. So this is how you have to reduce the femoral hernia, if it is reducible. If it is not reducible, when it becomes not reducible, this is the sac. Within the sac, contents are present, right? So for suppose this is the intestine. This wall of the sac and the wall of the intestine. If these two are connected with each other, that time reduction is not possible. In some other cases, there will be strangulation. Strangulation is what? For suppose this is the femoral ring. Contents are passing through the femoral ring, which leads to obstruction of the contents and obstruction of the blood vessels which are supplying to this part of the intestine, which leads to avascular necrosis. To prevent that, we have to reduce the hernia by widening of this femoral ring. That means we have to cut this lacunar ligament here. We have to cut this lacunar ligament and we have to widen the femoral ring and we have to reduce the hernia. In that case, one thing you have to remember very carefully. This is the internal iliac artery. This internal iliac artery will be giving one branch like this. This is what we call obturator artery. And here, this external iliac artery will be giving one branch, that is inferior epigastric artery. This is what we call inferior epigastric artery. This inferior epigastric artery and this obturator artery will give pubic branch. Here it is giving one pubic branch, here it is giving another pubic branch. These two pubic branches will be united or anastomosed with each other and forms as abnormal obturator artery. So this is what we call abnormal obturator artery. Usually this abnormal obturator artery is present just medial to the femoral vein. That time, if you cut this lacunar ligament, this blood vessel will not affect, so that we can easily reduce the hernia. But in some cases, this artery is present along the margins of the lacunar ligament. In this case, if you cut the lacunar ligament, along with the lacunar ligament, you will cut this artery also. That means you will cut the abnormal obturator artery, which leads to alarming bleeding. That means life-threatening bleeding.